Welcome to My Pocket Doctor's Diabetes Program. My name is Dr. Johan Manez. I'd like to run you through the basics of what has changed in diabetes. What we've known about diabetes has turned on its head, literally. What we now know today are the basic causes of diabetes, and knowing the cause of diabetes gives us a tremendous amount of power, because now we can turn diabetes around. To make sure we're at the same starting point, I will run you through the basics of diabetes. First, we will discuss the different symptoms of diabetes. Then we will discuss the different types of diabetes, and then the typical treatments that have been given to patients with diabetes. After that, I will teach you how we can actually reverse diabetes. How do we know it's diabetes? First, let's make sense of the symptoms that come with diabetes. Usually, diabetes may not have any symptoms to begin with. Some people may find out that they have diabetes because of a blood exam, but we do have specific symptoms that we can relate to as symptoms of diabetes. For some people, it's fatigue. You just don't have any energy. You feel tired, you feel very thirsty, and you notice that despite taking lots of amounts of water, you feel like you're losing a lot of water too, through lots of urination, for example. The fundamental problem is that the sugar from the bloodstream is unable to pass into the muscle cells. The sugar that we're talking about is glucose. This is the main source of energy of our body. And just like gasoline, without sugar, basically, we get tired, we get fatigued, and your muscle cells tire quickly. And this is why as you walk, as you go about your daily activities, you easily feel fatigued. So meanwhile, the sugar builds up in your bloodstream. As the sugar concentrates, it eventually pushes through your kidneys and ends up in your urine. Now, as the sugar is filtered out from your kidneys into your urine, it carries with it a lot of water. And this is why you have to take more frequent trips to the bathroom, because of all the extra urine that you produce. You may also find that you're losing weight. Now, in this situation, it is not a welcome event. You see, what is happening is all the food that you're eating is not entering, the nutrients from the food you're eating is not entering the cells in your body. So literally, you are malnourished even if you're eating a lot of food. Every day, people come to doctors' offices complaining of fatigue, frequent urination, weight loss, and sometimes constant hunger. Now, with these symptoms, the doctor will order a blood glucose and may find that the blood glucose is unusually high. We know that increased sugar in the blood is not a good thing because it creates all sorts of problems. So this overly large amount of sugar in our bloodstream can cause injury in the lining of the blood vessels that supply different organs of our body. Left unchecked, this high amount of sugar in the blood can then damage the lining of the capillaries that supply blood to your eyes, to your heart, and even the blood vessels that supply your kidneys. But as we have shown in the studies, we now know that diabetes and the high sugar in your blood is kind of a two-way street. It doesn't always have to be high blood sugar. In fact, we now know that we can actually bring down the blood sugar levels by things like a change in diet and other lifestyle factors. And when this happens, when you change your diet and you apply these principles, your sugar could go so low, and the damage that has been done can be reversed to a point where even your doctors, when they receive you after this program, may find it difficult to believe that you once had diabetes, and that's the good news. So we talked about the different symptoms of diabetes, including frequent urination, including thirst, including weight loss, and unusually high levels of hunger, for example. Now, when your doctor takes your blood sugar after an 8-hour fast, and your blood sugar shows to be more than 126 milligrams per DL, then your doctor will think or will provisionally diagnose you with diabetes. But to confirm this, he will have to do another test on another day. In some cases, doctors perform a tolerance test or a glucose tolerance test, where they will be asking you to drink a sugary drink of 75 milligrams of sugar, of glucose, and then 2 hours later will test your blood whether the blood sugar is within normal range. So if the blood sugar after a 2-hour wait is above 200 milligrams per DL, your doctor will diagnose you with diabetes. If your values are above the normal limit, but not high enough to be diagnosed with diabetes, your doctor will then diagnose you with pre-diabetes. A diagnosis of diabetes or even pre-diabetes means that the insulin in your body is not functioning as well as it should. Insulin, you see, is the hormone that moves sugar from your bloodstream into your cell, as we talked about earlier. Insulin works like a key to unlock the door or the glucose channels in your cells. So when insulin works properly, the nutrients from your bloodstream enter the cell. If the insulin doesn't work, let's say something's gummed up the lock, then of course the nutrients won't be able to enter your cell because these channels are closed. If for some reason your body does not produce insulin, this will result in rising blood sugar levels. Now similarly, if there is insulin, but the insulin doesn't work very well, then we will see a rise in blood sugar as well. Now, when you have insulin and the insulin doesn't work, this is a situation we call insulin resistance. So insulin resistance then means that there is a key, the insulin, there is a lock, but when you put the key to the lock, the doors don't open. Diabetes comes in 3 main types: type 1, type 2, and gestational diabetes. We're going to look at each one of those types. Type 1 diabetes usually manifests in childhood or early adulthood. The problem with type 1 diabetes is that something has damaged the cells in our pancreas that creates insulin. And so when insulin is not produced, then of course the blood sugar will remain in the blood. The sugar doesn't come into the cells because there is no key to open the gateways or the channels for glucose to enter the cell. Since type 1 diabetics don't produce their own insulin, they had to take it from outside sources. And typically this is through injection. You know, recent research has actually revealed to us that diet plays a huge role. And when you change your diet, even with type 1 diabetes, there are many complications that can be prevented. So we can say that diabetes type 1 is caused by a bioequivalent to friendly fire, where our own antibodies attack the cells of the pancreas that produce the insulin. Later on, we will find out the different causes of these different types of diabetes. But just to give you an idea, it is usually caused by certain things that we feed babies at a very young age. Type 2 diabetes used to be called adult onset diabetes, but today we see that this type of diabetes can be diagnosed in younger populations. Type 2 diabetes is the most common diabetes in the world. Of all the diabetics, 9 out of 10 will have type 2 diabetes. So in this type of diabetes, insulin tries to open the doors of your cells so that glucose from the bloodstream can enter your cells. But the problem is the locks seem to be malfunctioning. So in spite of the insulin being produced in huge amounts, the blood sugar continues to rise and rise. So being diagnosed with type 2 diabetes, your doctor may place a person with diabetes on certain drugs that help remedy this concern. It either makes your cells more sensitive to insulin, the drugs can produce more insulin to overcome the resistance, or the drugs could block the liver from producing more sugar or bringing more sugar into the bloodstream. So until today, diabetic diets will try to compensate for the insulin resistance by controlling the person's intake of sugar, for example, or starchy foods, because by doing this, they think that sugar in the blood can be controlled. The idea then is to control the amount of carbohydrate you take in so that your cells are not overwhelmed with the amount of glucose that is in the bloodstream. For people on medications, the typical diet plan aims to keep the amount of carbohydrate you take in at a constant level from meal to meal, day to day, so that the amount of drug that the doctors have to give you will remain fairly constant as well. So in short, these diets basically control when, how much to eat, what to eat, and can be really frustrating. What's exciting, however, is that new research shows that through dietary changes, you can directly influence the insulin resistance. And this is why this program was designed, to help you, through dietary changes, affect insulin resistance and ultimately reverse diabetes. The third type of diabetes is gestational diabetes. Gestational diabetes is very similar to diabetes type 2, except that it happens during pregnancy. Now, it typically goes away after childbirth, but just having gestational diabetes actually is a warning that type 2 diabetes may just be around the corner. Because we know the cause of type 2 diabetes, when we make the same changes that we use to tackle type 2 diabetes and apply it for gestational diabetes, we can totally prevent gestational diabetes from ever becoming type 2 diabetes. So in this first video, we've tackled the different symptoms of diabetes, how we can actually diagnose diabetes, and also the 3 types of diabetes. I'm hoping that you've understood every single part of this video, and by so doing, be prepared for the second video, where we will be talking more of the causes of diabetes and what we can do about it. My name is again Dr. Johan Mañez. Thank you for listening in. Have a great day.